Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and I am joined by another administrative fellow from Wellstar, Jessi. Jessi, please introduce yourself.
Hi, everyone. I'm Jessi Tran, and I'm currently the Hospital Operations Administrative Fellow at Wellstar.
And so I think the last administrative fellow we interviewed was a corporate administrative fellow, right? And that was Poojan. So this is a different angle, which we're really excited to learn about. But first, let's go back to the beginning of your career at, I think it was the University of Kentucky, right?
Yes, correct.
And so what was your degree choice and why did you choose to pursue that degree there?
So, I actually started off my undergraduate career being in exploratory health science, which is essentially an undecided major, sort of, but it's still in the College of Health Sciences. So, I knew I wanted to do health sciences. I just wasn't sure what I wanted to do yet. So, I was in that major for about a year, trying to figure out what pathways interested me in healthcare. And I honestly, on accident, I stumbled across a newer program in our College of Health Science called Clinical Leadership and Management. It was previously known as more of a health administration major, but they kind of refined the program so that you could take different avenues with your degree. So, completely on accident, I stumbled across this program. I applied to it and got in. And at the time, I also was hired to become a resident advisor. So prior to my experience as a resident advisor, I really didn't have a ton of experience in leadership or being in charge. I was very introverted, actually. So I found this major, learned more about leadership. I really found that leadership within me, I guess, being an RA and helping incoming students balance their school life and their personal life. So I really enjoyed it, but I also really enjoyed healthcare and helping other people. When I was in undergrad, I was on the student health plan like a lot of college students, and I just had a great experience with the clinical staff that I encountered, like, when going to the doctors. Obviously, when you're on the student health plan, you really don't have a designated PCP, like primary care provider, but I had a relationship with the physician that I would purposely schedule with him every single time I had to go to the doctor, and I kinda made him my unofficial PCP. And I was kind of in my head, I was like, It would be so amazing if every person had the same experience as me." So, from then, I was kind of also interested in, like, physician recruitment for a time, and that's why I enjoyed my major so much. Being in clinical leadership, I got to delve into more the business side of healthcare, learning about ethics and healthcare policy, and I truly just fell in love with it, and my naive self prior to discovering health administration, I thought that the doctors ran everything. Knowing what I know now, there's no way that doctors would have the time to provide care and do all the paperwork and deal with all the policies and all the administrative stuff in the background. So I knew that I wanted to not only lead others, but also do work in the background. And I do wanna acknowledge that there are definitely physician leaders out there in the C-suite who are, doing the work. My own chief medical officer is still practicing doctor. Sometimes he'll hop in and help the hospitalists day to day if they're short staffed. So, much kudos to those physicians and honestly just anyone with a clinical background who is in administration as well, because their insight is so important in this field as well.
I don't think I can handle doing both at once.
I don't think I don't think I could either, but it's wonderful to have their perspective.
Absolutely. It's essential too. I
Mm,
mean, either having them involved or having really strong partnerships. I want
yes.
to ask, how did you wind up at the University of Kentucky? Are you from that area originally?
Yes, I am. I was born in Louisville, Kentucky, and then my family moved. We lived in Northern Kentucky for a long period of time, and, well, I honestly just wanted in-state tuition, so I just ended up at University of Kentucky. There really wasn't a rhyme or reason. I'm really glad that I chose UK, though, because, CLM was a very unique degree to our
Yeah.
school.
And that health professions exploration program, that is not something, or health sciences
Mhm.
exploration, that's not something that a lot of institutions have, especially in, I know in the Northeast, it's competitive in the sense that you should already have a major picked out. You need to write like a book on why you want to get into that major, and then you get that. really steep tuition in the Northeast. So I think we need to take a page out of the University of Kentucky's playbook and start adapting that into some of the colleges up here, because that sounds like an excellent program that I would have liked to have done back
Yeah.
in my undergrad.
Yeah, it was really intimidating being, like, 18 years old and someone asking you, "What do you wanna do for the rest of your life?" And I was like, "Well, I know I wanna be in healthcare, I just don't know what." So it was just the perfect starting point for me in undergrad.
And then you decided to go into your MHA program right after that. And then you went to the top school for health administration,
Mhm.
UNC. Why did you choose UNC? Was it because it was one of the top programs?
Yes, partially yes. So I was at a point in my life where I needed change. And I had lived in Kentucky my whole life, went to school there, all my family was there. I was actually even thinking about staying in Kentucky and going to grad school. Grad school was always in the plans for me. But I reached a point where I kind of was like, I think COVID probably changed my mindset a lot, but I needed change and I needed to get out of my comfort zone. I love Kentucky. Did amazing and great things and learned from amazing people in Kentucky, but I felt like I needed to be not uncomfortable, to just have a different perspective, a change of scenery, if you will. So I actually only applied to 1 MHA program, unlike my fellowship program, but I only applied to 1 MHA program. I applied to UNC mostly because of the comprehensive, classes and, program, the faculty, the partnerships that UNC has, or specifically the MHA program has with other, like, health systems. The location was ideal for me, wasn't too hot, wasn't too cold, very similar to Kentucky. I took that into account as well, and so I applied and I told myself that if I got in, it was a sign, it was meant to be. And if I didn't, I would look elsewhere in Kentucky, as like a plan B, if you will. But I'm very happy that I got into UNC. I kind of have a moment of like self doubt. What if I don't get in? I don't want to say that I applied as I just I was very cautious about applying because I was like I just never thought a million years that I would get in, but I did, and I really enjoyed meeting the faculty during my interview session, and it kind of made me want it even more. I actually before I got my acceptance, I actually tried to I didn't wanna jinx myself, but I was so excited, I actually went out and bought my first ever, like, UNC sweatshirt, and I was like, "This is me believing in myself that I'm gonna get into this school."
So I've been asking people who go to UNC, did you take in any of the sporting events while you were down there?
I did, I was able to go to one basketball game. I went to with Pujin actually at the
Oh,
time,
nice. Like, we
and
were
our
actually
friend
talking
oh,
about
yeah,
that
we went.
today.
I unfortunately only got to go to one game. The student lottery was, like, really competitive. It was impossible to get a ticket, but I'm so glad I got to experience that. It's honestly just a different vibe, a different feeling, but it was great.
I think, but right before I moved, me and because my parents are from Raleigh, right before we
Mhm.
moved, I went to a UNC versus Duke with my dad, and it was a wild experience. And then I went to UNC Charlotte, so I was down on
Mhm.
the other side of the state. But I'm very fond of North Carolinians, so I love
Yeah.
talking to them whenever I come on. And so after your experience at UNC, decided to, or during your experience, actually, due to the internship first with Wellstar, how
Yes.
did that come about? I know that Wellstar is very well recommended from UNC. Is that kind of how you got connected?
Yeah, so this is what I went back to what I was saying about, like, how UNC has lots of partnerships with health systems. I know that UNC and Wellstar have a really good relationship, so it was just an intern posting that only went around to us UNC students and a couple other schools, I believe. They only Wellstar only recruits from certain schools for now because their
Yeah.
program is still super new. But yeah, it was just a random email, it wasn't posted publicly or anything, and I submitted my resume, and I got an interview, and that's when and I got an offer, and I accepted, and then so I did the Wellstar internship.
Excellent. And then where was that internship? Was that also in Atlanta?
Yeah, so it was in so my internship track, there was, I think, 4 different tracks, if I remember correctly. There's 4 of us interns. My track was with the Wellstar Medical Group, so I was based out of the corporate office, which is located in Marietta, Georgia.
Okay. So that's where Prusian is now, right?
Yes,
Okay,
correct.
interesting. You guys kind of did a little bit of it.
Yeah, we
That is
kinda we kinda flip-flop because
right.
Poojan did the hospital operations track for her internship, so she was at a hospital, and then I was at the corporate office, and now I'm at a hospital and she's at the corporate
That is
office.
great. So that is an interesting so we really are getting the full spectrum here.
Yes,
And
yes.
so after you did that at the corporate office, what made you decide to go to the hospital one in for the fellowship? And then also, did you apply for other fellowships? Poojan said that she did not apply for other fellowships from what I remember.
I applied to a lot of fellowships. Well, so during my internship, they do, I guess, a matching process. I'm sure based off of my answers in the internship interview, they kind of was like, "Oh, she would be really good in this track." So I'm really glad for my experience with WMG because I didn't have any experience in ambulatory care or outpatient care. So that was great exposure. And then when I interviewed for the fellowship, I kind of went in with an open mind. Of course, I was comfortable with WMG, well, that was one of our fellowship tracks, but told the interviewers that I would be open to any of the tracks. I'm interested in any of them. Just to, I don't know, more exposure, different experience would have been nice. I would have been fine with either way, but ultimately, I think, I don't know, I guess they knew more than me and they could tell that I would fit best in the hospital operations track, and they were right because I enjoy it very much, and in undergrad, I actually worked as a patient transporter at the UK hospital, and I really missed being in the hospital and interacting with a lot of clinicians and patients. So, ultimately, it was a great decision that they made.
That's awesome. Well, good for you, and congratulations on such a successful journey as well. You know,
Yeah,
you only applied to one MHA program, and it set you off on this excellent path.
it
So
really
that's
did, yeah.
great. So, what are some cool projects or people or things that you've done while working during your fellowship?
So, one of my very first big projects, actually, it's called Real Time Locating System or RTLS. A lot of hospitals have implemented this. It's basically where all of the equipment in our in-house, they have little tracker tags on them, kind of like air tags, but they have to be specially encrypted because, of course, we want to protect the information and things like that from hackers. So, essentially, we already have the system in place, working with Biomed for equipment maintenance essentially. So a lot of equipment every so often they have to undergo maintenance and the tracker helps with that because as soon as you put it on, it tracks like how long it's been on there and things like that. What was an issue with our hospital is a lot of nursing staff or other clinicians were having trouble locating items like equipment throughout the hospital. For example, we only have so many IV pumps. We only have so many of different just equipment in general. Wheelchairs honestly just
Yeah,
disappear throughout the
seriously.
hospital. So these equipment already had tags on them. It's just the nursing staff, I'm just using them as an example. The nursing staff didn't have access to see it.
Yeah.
So what I implemented was I connected with our team or with our IT team to essentially create an account for every single nurse manager, just to start off, nurse manager, assistant nurse manager, and nursing directors to have their own account to have access to this platform where they could go on it, click on the map and see exactly where each equipment was located. So you
Mm.
could type in the search bar like IV pump and it'll show you the map of the hospital and it'll be like, "Oh, there's one IV pump on the 3rd floor in room 107," or something like that. And just to create more efficiency with locating equipment, honestly, I'm still working on it because we're still working with Biomed to get additional equipment that our nursing staff has requested tagged so that they can, like, locate it better. I think it's incredible, and I love working on stuff like this, but that's just one example. Another favorite project that I'm working on right now is called Rocksteady Kickboxing. So it's essentially a specialized kickboxing class, a no contact kickboxing class for patients with Parkinson's disease.
Mm.
We're implementing that to have this class at least once a week in-house because we have a large patient population with Parkinson's disease. So it would be nice if patients could see their doctor, go to their appointments, and then go to this class to decrease their symptoms of Parkinson's
Wow.
disease.
That is, I work with patients with Parkinson's, so that's something that back in neurology that I'm very interested in as well. My grandmother had Parkinson's. My dad has the signs of Parkinson's. It's a rough disease. I'm probably going to have
Mhm.
Parkinson's, and so I'm very interested in that. That's incredible. So that must have the implementation of that map, right? I assume that was quite an undertaking, not just because of the access and the technology, but you had to make sure these people knew how to use it, right? Because this is a different
Yes.
system than what they've never used something like this before, right?
Yes. Yeah, so I actually our CNO, I work closely with her. She has a standalone meeting on a regular basis with her directors and managers of nursing. So I kinda did like a training session with them, show them how to use it, and I even offered, I was like, "My phone number is in my email signature. If you have any questions, I'm happy to show you. I'm happy to do it." But I think so far it's been pretty useful. And honestly, if they are still having, a hard time, they can honestly just email me and I'll do it for them. I'm happy to do that as well.
So you haven't gotten any, 2 a.m., 3 a.m. calls yet?
No, thankfully, no, but I wouldn't be opposed to answering because I know how frustrating it is to have to go floor by floor, room by room to look for one thing and delaying, like, patient care. That's
Of
what I
course.
don't want. Yeah.
And I know that Wellstar treats their nurses very well, but I think nursing is such a hard profession in general. So I can understand the frustration of not being able to find something just makes
Mhm,
everything worse. So that's an
mhm,
incredible tool that you were able to implement in a different way as well. And so what, one of the things that a lot of the fellows ask is how much freedom you have to do a project like that. So is this something that you just came up with? What kind of approvals did you need to get?
mhm,
What does that look like? Did you feel, like you were kind of given, almost free reign to do this,
mhm.
or was there a lot of approvals and process you had to go through?
So, as a fellow, I'm very grateful that I have a great support system, and that support system is our C suite. So, my preceptor is the CEO of North Fulton, but alongside him is, his COO, CNO, and CMO, and they all kind of adopted me as well. And whenever they see a problem or a project, they automatically think of me and put me on it. And I've always said that I'm an extra set of hands. I'm here to learn, and they know that as well. So they kind of, I guess, volunteer me to do things, but I'm happy again, I'm happy to do it because I trust their expertise, and if they think that a fellow should be on a project, they'll put me on it. Other and I also have full access to what's going on in the hospital, and I can kind of chime in where I think that I fit best. I'll, kind of raise my hand and volunteer myself to do it as well. But our previous CNO, he before he left, he was the one who was telling me about this and how like other hospitals are doing it, and he was like, "I want you to be on it, so that you can have experience working in nursing operations." So honestly, I'm just very grateful to have people who see my talents and think of me and want me to thrive.
Absolutely. That is an incredible asset to have. And you're also an incredible asset to them for sure. So that's wonderful. I want to ask, what are some recommendations? I mean, you already had some great recommendations, but what are some recommendations that you have on how people can be as successful as you've been in their fellowship? It seems like you're really valued. You have this close relationship with the C-suite, which not a lot of people, are able to have.
Mhm.
So, what are some things that you've done to get to that point where they can really rely on you for these projects?
I honestly think just staying or I guess I would say always be curious and show that you have interest in this. Let them know what your strengths are, but also what your weaknesses are, and ask. Ask and you shall receive is honestly what I've experienced at Wellstar. Ask and you shall receive. If I see something and I'm interested and I ask to be on it, 9 times out of 10, the answer is yes. If it's a no, it's something crazy or confidential, which is fine. Ask for help, show people your talents. I'm kind of known as PowerPoint and Excel girl around here because I'm really good at it, and I'm so flattered when people ask me for my help with that stuff because I didn't think that I was that good at it, but I love to also help and teach others. Another a couple other things is I've have a seat at the table and also know that you belong there.
Hmm.
That has been kind of a struggle for me, but it feels strange because 'cause I'm, young, I'm 20 something, I'm fresh out of grad school, and I'm sitting in the C-suite, I'm sitting in the boardroom with all these important people, but I'm going to sit like I belong there because I do.
Hmm. Nice. Very good advice. That's all very good advice. I recently received similar advice from my chief business development officer on how to, when I'm in these meetings, make sure I actually can have a voice by being like super knowledgeable about whatever
Mhm.
we're talking about is you need to know the agenda like front, back, and sideways so that when you go into the meeting, you're like confident about being there. So I think that's
Mhm.
excellent advice. One final question for you. Are you planning on staying with Wellstar after this fellowship? Or are you going to return to Kentucky? What is the future looking like for you?
I do plan on staying at Wellstar, so I'm almost towards the end of my fellowship. I'll end in July. I am on the job hunt internally for Wellstar. I would love to stay. I love the area. I do not currently have any plans of returning to Kentucky. I love and miss my family, but I know that my chance to grow is here in Atlanta, specifically in Wellstar. So hopefully, fingers crossed that I'll land a position post fellowship.
Excellent. Wellstar has great fellowship retainment from what I have
Mhm.
heard. So I think you'll be very successful there based on everything that I've heard during this interview. So good luck with that. I hope you do well. Are there any areas that you're looking at specifically or that you're very interested in?
I have fallen in love with hospital operations. I don't see myself doing anything else. So hopefully I stay in some sort of hospital operations role, maybe even nursing operations because
Mm.
I love working with nurses and making their job easier.
Excellent. I can tell. I can tell. You really, it came through in the way that you were describing
Mhm.
the projects, how much you enjoyed it. And I think that's special. Bill, thank you so much for joining us. This has been an excellent conversation. I'm, very excited to chat with someone from Wellstar again. If I do a fellowship, I think I'm thoroughly convinced to apply for one at Wellstar.
Yeah.
So I really appreciate your time.
Yeah, of course. Thank you.